For my presentation, I chose the Zika virus. What is the Zika virus and how was it understood? The Zika virus was first identified in humans in 1952, so by the time it came to America in July of 2016, the cause was known and backed by scientific evidence. Zika virus can be transmitted through mosquito bites, from mother to child, through blood transfusion, laboratory and healthcare exposure, as well as sex. In 1942, the virus was first identified in monkeys in Uganda. A monkey began experiencing a fever. On day 3 of the fever, a blood sample was taken from this monkey and injected into mice and another monkey. On day 10, after the injection, all mice showed symptoms of the virus. The first monkey showed no other symptoms while monkey number 2 remained asymptomatic. During the first 60 years of Zika's known existence, Zika was never reported. Less than 20 human infections were recorded during this 60-year extended period of silent transmission. It is likely that sporadic human cases of Zika have occurred for decades, but were understood as other conditions or simply went unrecognized. Zika virus was often understood as dengue, West Nile virus, bacterial infections, or parasites. They were understood as these conditions because both conditions showed similar symptoms. The Zika virus was first seen in America in July of 2016. Outbreaks have occurred in Africa, Southeast Asia, and the Pacific Islands. In May 2015, the first transmission of Zika virus in the region of the Americas was reported in Brazil. Following this, there was an increase in the number of infants born with microcephaly, or an abnormally small head. It is unknown how many of these cases are directly related to the Zika virus infection. In 2016, Zika virus transmission had been reported in America. Local transmission of Zika virus has not been documented in the United States, but infections have been reported among travelers visiting or returning to the U.S., leading to the 2015 to 2016 epidemic. We now understand that this disease is caused by being bitten by an infected mosquito from the Aedes genus, more specifically Aedes aegypti. Transmission can also occur from mother to child. Transmission from mother to child can result in a wide range of birth defects, including a partially collapsed skull, which would result in microcephaly, decreased brain tissue, or club foot. During the 2015 Zika epidemic in Brazil, the Zika outbreak coincided with the rise of birth defects, causing a connection to be made between the two. The connection between Zika and severe central nervous system malformations was confirmed in multiple studies in Brazil. Symptoms. Some people with the Zika virus are asymptomatic, while those who do experience symptoms can experience fever, rash, headache, joint pain, redness of eyes, muscle pain, fatigue, fever, chills, loss of appetite, or sweating. Treatment. Currently, there is no known medication specifically targeting Zika or a vaccine available for the virus. The medical community has treated the virus by recommending patients get lots of rest, drink lots of fluids, and take medicines such as Tylenol to manage pain and reduce fever. It is important not to take any aspirin until dengue fever can be ruled out in order to reduce the risk of bleeding. Currently, there are 18 known vaccine candidates in various stages of preclinical and clinical development. Research funding has been made accessible, however, there is not enough available, which is why it's taken so long to get a vaccine going. How is this virus viewed in society? In society, the Zika virus has been viewed as a scary thing since there is not a guaranteed way to avoid the virus. Society blames the government for the Zika virus. Travelers were often ostracized because that is how the epidemic initially began. The only way to completely prevent the Zika virus is to avoid mosquitoes altogether, especially when mosquitoes are most active, which is from sunrise to sunset. Bug, bug repellent sprays can help, however, it's almost impossible to avoid going outside from sunrise to sunset. Not only is there not a guaranteed preventative, but there is also not a known cure. Society, including public health officials, place a moral obligation on pregnant women to prevent the effects of Zika from harming their fetus. A lot of women aren't provided with the help that they need. Pregnant women, especially with limited resources, may not be able to afford additional doctor's visits or be able to stay inside all day. This isn't even to mention the access to diagnostic testing, which it can be very costly. This is a chart that I found online that I thought was helpful in summarizing all the key points about the Zika virus. And that concludes my presentation on the Zika virus. Thank you for watching.